Let's first have an overview of the cholinergic drugs before going to the examples and their uses. Here, we have, as usual, the receptor of our concern, which is either muscarinic or nicotinic. Though in this table, I focus more on the muscarinic because, again, these are more of the autonomic effects. Though this is still passable as a cholinergic receptor, meaning that if I have acetylcholine going to these cholinergic receptors, then of course, as expected, we get such effects as we see here, thus the blue arrow. Now, if we give a drug that is a cholinergic agonist, then of course, by being an agonist, you will cause the same effects as you see in the table. Thus, also the blue arrow, just like that of acetylcholine. Sometimes textbooks use the word cholinomimetics because they do mimic or imitate what this is doing. Now, naturally, if I have an antagonist, then we would observe the opposite effects. Instead of getting what we see on the table at the right, then we get the reverse of that, because when this goes to the same receptor in the same binding site, we will prevent these from taking place. Synonyms of these are called or are anticholinergics. The prefix anti is a giveaway, or sometimes acknowledging that muscarinic receptors are more dominant in the autonomic universe. We can call these also anti-muscarinics. Now, these two types of drugs are things that we can call direct acting. Whenever we hear the word direct acting drug, it's something that goes straight to the receptor of our concern, just like the agonist here going here or this antagonist going here. And most of the case, or most of the time, in all drugs in pharmacology, we do have direct acting medications. But in the context of ANS, it's quite unique because there's quite an emphasis placed on what we call indirect acting medications, which still elicit an effect that's related to this receptor, but it doesn't necessarily have to bind to this entire thing, to this actual thing. And these are two examples on top. Where are they heading? Towards this guy, acetylcholinesterase. So what does this have to do with the equation? Well, remember that in our overview of the life cycle of acetylcholine, this breaks down this one. Of course, if you break something down, you reduce the effects that are related to that, thus the red arrow here. You terminate it. But there are drugs that are actually known to inhibit, so I stands for inhibitor. There are drugs that are known to inhibit this guy. And it's like saying, I'm gonna fight someone who is fighting my friend. So like the enemy of my enemy is my friend. So thus, the color coding here is blue. It's as if it gives us these effects. It's an agonist. So I can say that cholinesterase inhibitors are indirect acting agonists. On the other hand, if I have a regenerator of acetylcholinesterase, then if there are any of these that are being suppressed by a previous or by a first molecule or chemical or poison, then a regenerator can unblock that, and basically allowing this to run free will mean decreasing this. So like the friend of my enemy is also my enemy. Thus, it's color-coded red. It's an antagonist. We can say that these are indirect acting antagonists. With that said, let's go to these different cholinergic drugs.